Spain's public healthcare system is not what I expected. Hi, I'm Liz, and on this channel, I'm documenting my family's new life in Spain. Enrolling in the public healthcare system here in Spain was fairly simple. We live in Seville, and Seville is in the Andalusia region. We just went down to our local medical center, filled out a couple of forms, uh, showed some documents, and that was basically it. On that same day, we went ahead and scheduled our primary care appointments, and they were about 2 weeks out from the day that we went in and enrolled. On my first primary care appointment, I was the first one. This clinic opened at 8, and I believe my appointment was like 8:15 in the morning. The doctor comes out, called me in. There was no nurse helping out the doctor. I sat down. She asked me, well, what are you here for? And I explained I needed blood pressure medication, and my arthritis in my knee was really bad, and the issue I've been having with my ankle, and that I had been seeing a private podiatrist in the area. The doctor asked me my date of birth and did I bring the records from the podiatrist. Did not, and she looked at my ankle, looked at my knee, and just said, well, next time you schedule an appointment, bring me the records from the podiatrist. And she just gave me a prescription for blood pressure medication and explained how I should be taking the ibuprofen and their the generic Tylenol, what we would consider Tylenol. On my second primary care appointment, it was a male doctor. My primary care doctor uh, was on vacation, and this appointment was 2 weeks out. Same same procedure with this doctor as well. They just called me in. There was no blood pressure check, no temperature check, no weight check, no asking, are you in pain? It was just, what are you here for? But this time I was ready. I had a list of things that I wanted him to look into, and that included referrals for the issue with my knee, my ankle, um, pulmonologist referral so that I could get CPAP equipment for my CPAP machine. Um, and I also asked him if I could get an injection for my arthritis, knee pain, and the pain I was having in my ankle. He said he couldn't give me that injection, but that once I saw the specialist, that to mention that and see, they would recommend whether they'll have someone give me an injection or maybe some medication. He basically didn't want to give me a prescription for any kind of pain meds for my arthritis. And so I was fine with that. Okay, I can hold out with that. I did get a text about 2 to 3 days out from that second appointment with the primary care doctor, and it was an appointment that was set up to see the pulmonologist, and that was actually like almost a month out. So I still haven't gone to see the pulmonologist, but at least I have that appointment set up. And as far as my knee and my ankle, um, that I think is going to take a little longer. I haven't gotten a text about an appointment. I did, however, get a text with a scheduled mammogram, and that was about 2.5 weeks out. Went to that appointment. To my surprise, the technician that did the mammogram was a male, something that I'm not used to. Back in the US, I've always had female technicians doing mammograms, and that was kind of uncomfortable and a shock, but the male technician was professional, but again, it just wasn't something I was expecting. So, in conclusion, in my opinion, I think Spain does have a good public healthcare system because it is accessible to everyone. Um, it's not free, you are going to pay, but it is extremely affordable. There are wait times for certain specialists, for surgeries, and of course, if you go to the emergency room. But the fact that it's accessible to everyone, I think, makes it a really good public healthcare system. Thank you for watching. See you on the next one.